Mr. President, today is the day when we will begin to repeal and replace Obamacare. Repealing and replacing this disastrous law is one of the top jobs that citizens elected us to get done. And in many ways, it's why Donald J. Trump will be sworn in next week as the 45th President of the United States. But I think what is most helpful is to recap why repealing Obamacare is so important to so many American families. Montanans were promised that with this bill you could keep the health plans that you liked. That was wrong, and millions of Americans lost their plans. Montanans were assured that coverage under Obamacare would be affordable. For millions of Americans, for thousands of Montanans, nothing could be further from the truth. Montanans were guaranteed that Obamacare would lower health care costs. We've witnessed premiums skyrocket since Obamacare's implementation. Finally, Montanans were assured that Obamacare would create more competition in the marketplace. But now Americans in one-third of the counties across our entire country have but one plan to choose from. And let's not forget, supporters of Obamacare paid for these failed programs by raiding Medicare by over $700 billion. Seniors and people with disabilities in Montana and across our country deserve much, much better. Over the past several years, I have heard from countless Montanans about how Obamacare has failed them. Take, for example, Terry from Choteau, Montana, who wrote, "We just got a letter from Pacific Source that our premium is going up $260 per month. Our deductible is going up to $1,000. This is $1,025 per month and a $7,500 deductible for two healthy adults with no pre-existing conditions. For a ranch family, that's a huge hit, especially in these times with low commodity prices. Something needs to change." Or Jeff from Kalispell, Montana, he said this, "I am married with 5 children. I live in Kalispell. I bought Blue Cross Blue Shield of Montana, the PPO Gold Insurance Plan number 104 for the 2016 year. My premium was $1,477.28 per month. In early November 2016, 2 months ago, I received notice that my same plan would increase to $2,820 per month. That's a 91% increase. If keeping the same rate hikes, my insurance will be $5,500 in 2018, then $10,000 per month in 2019. And this is from Jeff in Kalispell, Montana. I have Anthony from Bozeman. That's my hometown. I went to kindergarten through college in Bozeman. A fellow Bozemanite writes this to me. He says, "I've never been able to afford Obamacare insurance. With quotes of over $400 a month for a single healthy male, I found it easier to pay the penalty. So now, not only can I not afford to have medical insurance, but I'm getting fined for not making enough money to pay all of my bills, and I give a 20% tithe to the medical insurance industry." Here's another Bozemanite, Kenneth. He writes this, "For 2014, we had medical insurance from Pacific Source for my wife, which was adequate and it filled our needs. For 2015, Pacific Source canceled that policy, citing Obamacare rules, and the best alternative was 150% more expensive. We did it for 6 months, and then it canceled. It just took too much from our budget. The IRS fined us $584 for missing insurance for 6 months. We are doing without coverage for 2016 again because of the outrageous cost for this high deductible policy. Our IRS fine will probably be about $1,500. The list and the heartfelt stories go on. And they all share one common theme. Obamacare is not working. Now, this Obamacare hardship didn't just impact Terry, Jeff, Anthony, or Kenneth. Montanans, on average, face premium increases between 27 and 58% just this last year. This is year-over-year numbers. Last evening, I had a teletown hall meeting where thousands of Montanans joined me. Thousands across the entire state. Every corner of our state was on the call last night. I asked a simple question. I said, how many of you would want to repeal Obamacare? An overwhelming 82% said they support the repeal of Obamacare. And the reason why is quite simple. They didn't get what was promised to them on this very floor of this chamber back in 2010. Obamacare is failing because it is a massive intrusion by the federal government. And it is centered on raising taxes, huge spending increases, and heavy regulations from Washington, D.C. It is straight from the big government, Washington knows best playbook. And that is what happens when Congress doesn't listen to the American people. You know, Montanans have pretty good horse sense. They know when somebody from Washington, D.C. shows up and says, we've got this 2,700-page bill from Washington, D.C., led by Nancy Pelosi, Harry Reid, and President Obama. Montanans know better. They know they should run for cover. And that is exactly what Obamacare is and what's happening right now to the American people. Obamacare can't be tweaked. It's got to be repealed. It needs to be replaced with better reforms. And we need to make sure that we do as much as we can, as soon as we can, so folks aren't having to deal with Obamacare for much longer. People are hurting. It's time to replace it. I urge my Democratic colleagues to work with us. Don't use scare tactics. Unlike 2009, we are focused on a path forward that conveys practical benefits, not hopeless ideology. I ask them to accept the reality that Obamacare is irreversibly flawed. It must be repealed, and it must be replaced with effective policies. I know there are comments out there about a plan and what's next. Well, for me, it's not that complicated. It's getting the costs down. You've heard the stories. The American people are asking for relief for the generation of Americans just now entering the workforce, and that would be my kids. They're just entering the workforce. Healthcare costs have increased by 77%. This is outrageous. It's unacceptable. These are supposed to be the easiest people to insure. Yet Obamacare seems intent on placing health care out of their reach. I believe there are policies that are fundamental to any health care system, and we'll be working and fighting provisions that provide access to affordable insurance, that protect people with pre-existing conditions, that allow young adults to stay on their parents' coverage until age 26, that return decision-making authority back to the states, that will eliminate these harmful Washington regulations and mandates, to empower the American people with greater access to health savings accounts. That was part of the healthcare system was actually working pre-Obamacare, and Obamacare moved in and slashed healthcare savings accounts. We need to make it easier to purchase health insurance across state lines, encourage and incentivize work among able-bodied Americans, and uphold fiscal responsibility by preserving and protecting Medicare for our seniors. I very much look forward to working with the nominee for the United States Department of Health and Human Services, Dr. Tom Price. I serve with Dr. Price in the House. There's not a better leader at this point in time in our nation's history to assume the leadership in the Department of Health and Human Services. He's a doctor, served in Congress, able and ready to lead from day one. We will work together to find the best solutions, Montana solutions, solutions that work for our respective states, for people like Terry, for Jeff, for Anthony and Kenneth, and the thousands of other Montanans that have been harmed by this law.